CIET NCERT presents audio book of Social Sciences for Class 7.
Audiobook Social and Political Life Part 2 Class 7 Unit 2 titled State Government. This unit has 2 chapters in it. Chapter 2 Role of the Government in Health and Chapter 3 How the State Government Works. Page 16 Unit 2 Page 17 State Government. Teacher's Note. These 2 chapters, Chapter 2 and 3 on state government, are an attempt to discuss the functions and structure of government through concrete situations. We have chosen health as an example. There could have been other, equally important choices.
Chapter 2 discusses health as an important issue for people. There are both public and private aspects of health provisioning. Healthcare in India is not available to all. While the Constitution supports a view that the right to health is an aspect of our fundamental rights, its provisioning is rather unequal. Through the accounts provided, learners will begin to visualize the ideal or desired role of government and the meanings behind its structures. Some ways in which this situation can be changed are also discussed.
Chapter 3 focuses on how the government functions and discusses ideas of representation, accountability, and public welfare. Though both the executive and the legislature are presented, one should not expect students to retain fine distinctions. It would be best to patiently encourage them to ask questions such as, who is the most powerful person? Why can't the MLA solve the problem? Etc. Such queries will enable them to construct a sense of the government apparatus.
It is important that learners acquire the confidence to express their views on public issues and understand the role of government through the exercises given in the chapters. You could choose familiar issues such as water, transport, school fees, books, child labor, etc., for them to discuss and arrive at how these problems need to be tackled. Allow them to express these ideas through wall charts. Given that discussion on the government and its functioning often lead to boredom and cynicism, we need to be able to make the classroom session less didactic and more interactive while teaching these lessons.
Page number 18. Chapter 2 titled Role of the Government in Health. In a democracy, people expect the government to work for their welfare. This could be through the provision of education, health, employment, housing, or the development of roads, electricity, etc. In this chapter, we shall examine the meanings and problems related to health. Look at the subheadings of this chapter. In what ways do you think this topic is related to the work of government?
Here on page number 18, there are different pictures given from slum area, from a hospital, from a vegetable market, and of children playing.
Page number 19. On this page, there are a few pictures given. In one of the pictures, 2 rural women can be seen carrying water in earthen pots. An ambulance can be seen in a rural area. A photograph of a slum is given. A few children are playing in a photograph and others are going to school. In one of the photographs, 2 doctors are there in an operation theatre. Would you associate all or some of these pictures with health? In what ways? Discuss in groups. Pick 2 situations from the above collage that are not related to illness and write 2 sentences on how they are related to health.
What is health? We can think of health in many ways. Health means our ability to remain free of illness and injuries. But health isn't only about disease. You may have associated only some of the situations in the above collage with health. What we often ignore is the fact that each of the above situations is related to health. Apart from disease, we need to think of other factors that affect our health. For example, if people get clean drinking water or a pollution-free environment, they are likely to be healthy. On the other hand, if people do not get adequate food to eat or have to live in cramped conditions, they will be prone to illness.
All of us would like to be active and in good spirits in whatever we may be doing. It isn't healthy to be dull, inactive, anxious or scared for long stretches of time. We all need to be without mental strain. All of these various aspects of our lives are a part of health. Page number 20.
Healthcare in India. Let us examine some of the aspects of healthcare in India. Compare and contrast the situation expressed in the first and second columns.
There is a table given here on page number 20, in which there are two columns. Each of the columns has 4 points in it.
In the first one, it reads, India has the largest number of medical colleges in the world and is among the largest producers of doctors. Approximately more than 30,000 new doctors qualify every year.
The contrasting point given opposite to this point reads, most doctors settle in urban areas. People in rural areas have to travel long distances to reach a doctor. The number of doctors with respect to the population are much less in rural areas.
The second point reads, healthcare facilities have grown substantially over the years. In 1950, there were only 2,717 government hospitals in India. In 1991, there were 11,174 hospitals. In 2017, the number grew to 23,583.
The contrasting point given opposite to this point reads, about 5 lakh people die from tuberculosis every year. This number is almost unchanged since independence. Almost 2 million cases of malaria are reported every year, and this number isn't decreasing.
Third point reads, India gets a large number of medical tourists from many countries. They come for treatment in some of the hospitals in India that compare with the best in the world.
The contrasting point given opposite to this reads, we are not able to provide clean drinking water to all. 21% of all communicable diseases are waterborne. For example, diarrhea, worms, hepatitis, etc.
Fourth point reads, India is the third largest producer of medicines in the world and is also a large exporter of medicines.
The contrasting situation given here opposite to this fourth point is, half of all children in India do not get adequate food to eat and are undernourished. A note has been given above this table. It reads, can you provide a title to these columns? In India, it is often said that we are unable to provide health services for all because the government does not have enough money and facilities. After reading the points given in the left-hand column, do you think this is true? Discuss.
In order to prevent and treat illnesses, we need appropriate healthcare facilities such as health centers, hospitals, laboratories for testing, ambulance services, blood banks, etc. that can provide the required care and services that patients need. In order to run such facilities, we need health workers, nurses, qualified doctors and other health professionals who can advise, diagnose, and treat illness. We also need the medicines and equipments that are necessary for treating patients. These facilities are required to take care of us.
Page number 21. India has a large number of doctors, clinics, and hospitals. The country also has considerable experience and knowledge in running a public healthcare system. This is a system of hospitals and health centers run by the government. It has the ability to look after the health of a large section of its population scattered over hundreds of thousands of villages. We will go into more detail on this later. Moreover, there has been a phenomenal advancement in medical sciences whereby many new technologies and treatment procedures are available in the country.
However, the second column points out how poor the health situation in our country is. With all the above positive developments, we are not able to provide proper healthcare facilities to people. This is the paradox, something that is contrary to what we would expect. Our country has the money, knowledge, and people with experience but cannot make the necessary healthcare available to all. In this chapter, we will look at some of the reasons for this.
A picture is given here on page number 21. In this picture, we can see people gathered at a government hospital. A note is given here alongside the picture which reads, "Patients usually have to wait in long queues in government hospitals, like this one." Read the story given here. Then imagine that you are a judge in the court. What would you say to Hakim Sheikh?
The story of Hakim Sheikh. Hakim Sheikh was a member of the Paschim Banga Khet Mazdoor Samiti, PBKMS, an organization of agricultural laborers in West Bengal. One evening in 1992, he accidentally fell off a running train and suffered head injuries. He was in a very serious condition and needed immediate treatment.
He was taken to a government hospital in Kolkata, but they refused to admit him because they did not have a spare bed. Another hospital did not have the facility or the specialized doctors necessary for his treatment. In this way, he spent 14 hours in a critical state and was taken to 8 different government hospitals, but none of them admitted him.
Finally, he was admitted in a private hospital, where he received treatment. He spent a lot of money on his treatment. Angry and upset over the indifferent attitude of all the hospitals that refused to admit him, Hakim Sheikh and PBKMS filed a case in the court.
Page number 22. There is a story given here on page number 22 which has been described in the form of different pictures. The title of the story is The Cost of a Cure. Aman and Ranjan are good friends. While Ranjan comes from a well-to-do family, Aman's parents have to struggle to make ends meet.
Hi, Aman. Good to see you back. How have you been?
I had viral fever and had to go to the hospital.
Oh, me too. I just got back to school on Monday. My daddy took me to see the doctor at the new hospital in Kingsway. It was very exciting. The building looked so posh. I thought it was a 5-star hotel. Daddy said that was because it was a private hospital with the best of facilities. Daddy had to pay rupees 500 at the reception counter itself. Before we even met the doctor, there was nice music playing and everything was really clean and shiny. The doctor asked for many tests, but everyone was so friendly. The lady who took my blood for testing told me so many jokes that I forgot to feel the pain.
In the next picture, a lady is taking the blood from Ranjan's hand for testing purposes. She is saying to Ranjan,
And have you heard the one about Batman on reality TV? After the test results came, we went back to the doctor. He looked through them and said everything was fine. And I only had viral fever. He prescribed some medicines and rest.
In the next picture, the doctor is telling Ranjan and his father, And so, young man, this pink pill should be taken 3 times a day, and the white tablet once before bedtime. That's for the body ache. This one is a syrup. Don't worry, it's tasty.
Thank you, doctor. I feel better already.
Page number 23. The story continues.
You see, I've been dying to tell you all about it. But what about you? Which hospital did you go to?
It wasn't as nice as yours at all. At first, Abba didn't want to take me because he said it would take too much time. And it really did. We went to a big government hospital. We had to wait in a long queue at the OPD counter. I was feeling so sick that I had to lean on Abba all the time. When our turn came, the doctor examined me and asked for a blood test. Then we had to go and stand in another long queue. People were crowding around in the testing room too. We got the test results after 3 days and went back to the hospital. There was a different doctor that day. In the next picture, Aman and his Abba can be seen talking to a lady doctor.
Show me his OPD card and the test results quickly, please. He seems to be suffering from a bout of viral fever. Nothing to worry about. All he needs is this one fever-reducing medicine. My hospital was nice, but they gave me many medicines, and the whole thing cost quite a lot.
Oh, my treatment did not cost much. Page number 24. Where do you go when you are ill? Are there any problems that you face? Write a paragraph based on your experience. What problems did Aman face in the government hospital? How do you think the hospital can work in a better manner? Discuss. Why did Ranjan have to spend so much money? Give reasons. What problems do we face in private hospitals? Discuss.
Here on page number 24, there is a highlighted box given. It reads, Why pay taxes to the government? Government uses tax money for providing many public services for the benefit of all citizens. Some services such as defense, police, judicial system, highways, etc. benefit all citizens. Otherwise, the citizens cannot organize these services for themselves. Taxes fund development programs and services such as education, health care, employment, social welfare, vocational training, etc., required for needy citizens. Tax money is utilized for relief and rehabilitation in case of natural disasters such as floods, earthquakes, tsunami, etc. Space, nuclear and missile programs are also funded from the revenues collected as taxes. Government provides some services specially for the poor who cannot afford to purchase them from the market. One example is healthcare. Can you give other examples?
Public and private healthcare services. From the story given here, you must have understood that we can roughly divide up various healthcare facilities in 2 categories. A. Public health services and B. Private health facilities. Public health services. The Public Health Service is a chain of health centers and hospitals run by the government. They are linked together so that they cover both rural and urban areas and can also provide treatment to all kinds of problems, from common illnesses to special services. At the village level, there are health centers where there is usually a nurse and a village health worker. They are trained in dealing with common illnesses and work under the supervision of doctors at the Primary Health Center, PHC. Such a center covers many villages in a rural area. At the district level is the district hospital that also supervises all the health centers. Large cities have many government hospitals, such as the one where Aman was taken, and also specialized government hospitals, such as the ones in Hakim Sheikh's story.
The health service is called public for many reasons. In order to fulfill its commitment of providing healthcare to all citizens, the government has established these hospitals and health centers. Also, the resources needed to run these services are obtained from the money that we, the public, pay to the government as taxes. Hence, such facilities are meant for everyone. One of the most important aspects of the public health system is that it is meant to provide quality healthcare services, either free or at a low cost, so that even the poor can seek treatment. Another important function of public health is to take action to prevent the spread of diseases such as TB, malaria, jaundice, cholera, diarrhea, chikungunya, etc. This has to be organized by the government with the participation of people, otherwise it is not effective. For example, when taking up a campaign to see that mosquitoes do not breed in water coolers, rooftops, etc., this has to be done for all houses in the area. Page number 25.
Recall the case of Hakim Sheikh. Would you like to know what the court said in this case? According to our constitution, it is the primary duty of the government to ensure the welfare of the people and provide healthcare facilities to all. The government must safeguard the right to life of every person. The court said that the difficulty that Hakim Sheikh had to face could have cost him his life. If a hospital cannot provide timely medical treatment to a person, it means that this protection of life is not being given. The court also said that it was the duty of the government to provide the necessary health services, including treatment in emergency situations. Hospitals and medical staff must fulfill their duty of providing the necessary treatment. Hakim Sheikh was denied treatment at various government hospitals. Therefore, the court asked the state government to give him the money that he had spent on his treatment.
Here on page number 25, there is a picture given. In this picture, a pregnant lady has come here for her treatment. It reads, "A doctor in a rural healthcare center giving medicines to a patient." In the second picture, a woman and her sick child at a government hospital are there. According to UNICEF, more than 1 million children die every year in India from preventable infections. In what ways is the public health system meant for everyone? List some primary health centers, PHCs, or hospitals near your place. From your experience or by visiting any one of them, find out the facilities provided and people who run the center.
Private health facilities. There is a wide range of private health facilities that exist in our country. A large number of doctors run their own private clinics. In the rural areas, one finds registered medical practitioners, RMPs. Urban areas have a large number of doctors, many of them providing specialized services. There are hospitals and nursing homes that are privately owned. There are many laboratories that do tests and offer special facilities such as X-ray, ultrasound, etc. There are also shops where we can buy medicines. Page number 26.
As the name suggests, private health facilities are not owned or controlled by the government. Unlike the public health services, in private facilities, patients have to pay a lot of money for every service that they use. Today, the presence of private facilities can be seen all around. In fact, now there are large companies that run hospitals and some are engaged in manufacturing and selling medicines. Medical shops are found in every corner of the country.
There is a picture given here on page number 26, in which a post-operative room in a leading private hospital in Delhi is shown. Private health facilities can mean many things. Explain with the help of some examples from your area. A colored box is given here on page number 26. It reads, "The Medical Council of India's Code of Medical Ethics states, every physician should, as far as possible, prescribe drugs with generic names and he or she shall ensure that there is a rational prescription and use of drugs." How can healthcare be made more affordable? Discuss.
Healthcare and equality. Is adequate healthcare available to all? In India, we face a situation where private services are increasing, but public services are not. What is then available to people are mainly private services. These are concentrated in urban areas. The cost of these services is rather high. Medicines are expensive. Many people cannot afford them or have to borrow money when there is an illness in the family. Some private services encourage incorrect practices to earn more. At times, inexpensive alternatives, though available, may not be used. For example, some medical practitioners are found to prescribe superfluous medicines, injections or saline when simple medication may suffice. In fact, barely 20% of the population can afford all the medicines that they require during an illness.
Page number 27.
Hence, even for those whom one might not think as being poor, medical expenses cause hardship. It was reported in a study that 40% of people who are admitted to a hospital or some illness or injury have to borrow money or sell some of their possessions to pay the expenses.
For those who are poor, every illness in the family is a cause of great anxiety and distress. What is worse is that this situation tends to happen again and again. Those who are poor are in the first place undernourished. These families are not eating as much as they should. They are not provided basic necessities like drinking water, adequate housing, clean surroundings, etc., and therefore are more likely to fall ill. The expenses on illness make their situation even worse. Sometimes it is not only the lack of money that prevents people from getting proper medical treatment. Women, for example, are not taken to a doctor in a prompt manner. Women's health concerns are considered to be less important than the health of men in the family. Many tribal areas have few health centers and they do not run properly. Even private health services are not available.
Here on page number 27, there is a picture given. In this picture, scene of a rural area is given, where a jeep is being used as a mobile clinic for patients. The second picture describes that a pregnant lady has to travel many kilometers to see a qualified doctor. The third picture describes good health and well-being of a mother and a child. With the reference of Sustainable Development Goal SDG, www.in.undp.org.
What can be done? There is little doubt that the health situation of most people in our country is not good. It is the responsibility of the government to provide quality healthcare services to all its citizens, especially the poor and the disadvantaged. However, health is as much dependent on basic amenities and social conditions of the people as it is on healthcare services. Hence, it is important to work on both in order to improve the health situation of our people. And this can be done. Let's hear the example given on the next page. Page number 28.
The Kerala Experience. In 1996, the Kerala government made some major changes in the state. 40% of the entire state budget was given to panchayats. They could plan and provide for their requirements. This made it possible for a village to make sure that proper planning was done for water, food, women's development and education. This meant that water supply schemes were checked, the working of schools and anganwadis was ensured and specific problems of the village were taken up. Health centers were also improved. All of this helped to improve the situation. Despite these efforts, however, some problems such as shortage of medicines, insufficient hospital beds, not enough doctors remained, and these needed to be addressed. For more details, visit http://isgkerala.gov.in/en. Let us hear an example of another country and its approach to issues of health.
On this page, there is a political map of the Indian Republic given. It says, the map given here of India shows the state of Kerala in pink. Various states of the country are shown in different colors. At the southern side, the Arabian Sea, the Indian Ocean, and the Bay of Bengal are shown. Another note reads, page 111 of this book has a map of India. Using your pencil, outline the state of Kerala on this map. The Costa Rican approach. Costa Rica is considered to be one of the healthiest countries in Central America. The main reason for this can be found in the Costa Rican Constitution. Several years ago, Costa Rica took a very important decision and decided not to have an army. This helped the Costa Rican government to spend the money that the army would have used on health, education, and other basic needs of the people. The Costa Rican government believes that a country has to be healthy for its development and pays a lot of attention to the health of its people. The Costa Rican government provides basic services and amenities to all Costa Ricans. For example, it provides safe drinking water, sanitation, nutrition and housing. Health education is also considered very important, and knowledge about health is an essential part of education at all levels. Page number 29. Exercises. 1. In this chapter, you have read that health is a wider concept than illness. Hear this quote from the Constitution and explain the terms living standard and public health in your own words. A quote from the Constitution of India is given here. It reads, an important part of the Constitution says, it is the duty of the state to raise the level of nutrition and the standard of living and to improve public health.
2. What are the different ways through which the government can take steps to provide health care for all? Discuss.
3. What differences do you find between private and public health services in your area? A table is given here on page number 29 to compare and contrast the differences between private and public health services in your area. In this table, there are 4 columns given. These are named as facility, affordability, availability, and quality. Under the column of facility, Two words are written. In the first row, it is written private. In the next, it is written public. You have to fill this table to compare and contrast between private and public health services.
4. Improvement in water and sanitation can control many diseases. Explain with the help of examples. Here on page number 29, there is a picture. This picture describes clean water and sanitation. With reference to Sustainable Development Goal SDG, www.in.undp.org.
Glossary. Public. An activity or service that is meant for all people in the country and is mainly organized by the government. This includes schools, hospitals, telephone services, etc. People can demand these services and also raise questions about their non-functioning.
Private. An activity or service that is organized by an individual or company for their own gain.
Medical tourists. This refers to foreigners who come to this country specifically for medical treatment at hospitals that offer world-class facilities at a lower cost than what they would have to pay in their own countries.
Communicable diseases. These are diseases that are spread from one person to another in many ways, such as through water, food, air, etc.
OPD. This is the short form for outpatient department. This is where people are first brought in and treated in hospital without being admitted to any special ward.
Ethics. Moral principles that influence a person's behavior.
Generic names. These are chemical names of the drugs. They help in identifying the ingredients. They are globally recognized. For example, acetyl salicylic acid is the generic name of aspirin. You were just listening to chapter number 2, titled Role of the Government in Health.